Hello and welcome back to part 5 in our educational video series that we have branded as our Hygiene Connection. Today I'd like to discuss with you the importance of your oral health and the role that it plays in the health of your heart and also its link to diabetes. So could a healthy mouth equal a healthy heart? More and more research is showing for this to be true. Doctors have been discussing this for over 2 decades, the link between a healthy mouth and a healthy heart. Cardiovascular disease is a very serious problem around the world, as well as poor oral health. So is it possible for the dentist or the dental hygienist to take a look in your mouth and detect other serious illnesses? Well, the answer is yes. The health of your mouth plays a vital role in your overall health. We know that periodontal disease is an infection that is linked to heightened bacteria within the oral cavity. When this bacteria is at high levels, it sets off an infection within the soft tissues within your mouth. As we have discussed many times in our previous videos, when this infection is active, the bacteria that is present at high amounts actually travels through the bloodstream. It creates what we refer to as a systemic inflammation. When this bacteria travels through the bloodstream, it's also called a bacteremia. This bacteria can settle anywhere within the body. It has been found that it settles at the heart. This inflammation sets in, and actually what it does is this bacteria will attach to the inside the walls of arteries. When this happens, it weakens the arterial wall, which lends to an increased chance of stroke. It also can weaken the heart muscle. With these inflammatory processes at a heightened level can lend to the possibility of having a heart attack. So you can see how important it is to keep the oral bacteria as low as you possibly can through your brushing, through your flossing. And I would suggest also adding an antibacterial rinse twice a day, which helps kill some of the bacteria within the oral cavity. Now, seeing your oral health care provider, seeing your dental hygienist on a regular basis, it is our job to also go after that bacteria that is so destructive. When you have active periodontal disease, there are physical changes that occur within the soft tissue in your mouth. When these changes occur, these pocket depths become deeper, and it almost is not manageable from your end to reach that bacteria and clean it out because these pockets are so deep. Your toothbrush and your dental floss can only go so deep underneath the gum. The toothbrush, it is shown, reaches about 1 millimeter underneath the gum line. Dental floss will reach about 3 millimeters. So when your dental hygienist is calling off all those numbers and measuring those pocket depths with her probe, when you hear numbers 4, 5, 6, your dental floss is not reaching the base of the pocket and cleaning out that bacteria. Now we can get to it, because we have instruments that are specially designed to get into the depth of the pocket and clean out the bacteria. And by doing that and maintaining it, we can decrease those pocket depths so you can manage your oral care at home better. So we know that this bacteria weakens the heart, it weakens the arterial walls. Now, what is the link to diabetes? Having periodontal disease does not give you diabetes. But what happens when a patient presents as a diabetic, we all know that the immune system is compromised when you're diabetic. So when you have bacteria anywhere on the body, when you have a surgery, when you get a cut, it is harder for a diabetic patient to heal because their body can't fight the bacteria as well. So I would say at least 98% of the diabetic patients that I see in my chair have some form of periodontal disease. I see these patients on an average of every 3 to 4 months so we can keep the bacteria low. They may be doing their home care at home, but they're not able to fight this bacteria as well as a patient that does not have diabetes. And what happens when periodontal disease remains active at a heightened level in a diabetic patient It also decreases their body's ability to lower their blood sugar. So blood sugar is heightened. So it's almost a vicious cycle with gum disease being active and their blood sugar at a dangerous level. So we see these patients on a more regular basis so we can keep the bacteria low, and then they can control their blood sugar better. So again, it's not that periodontal disease causes diabetes, it's just that there's an adverse effect with a diabetic patient when they present with active gum disease, and they're more susceptible to breakdown within the oral cavity. So I can't stress again enough how important it is to see your oral health care provider. And, together it is our goal to keep our patients as healthy as we can for an overall comprehensive good health. So we invite you to share these videos to your friends and family, and together we can ensure good health for our loved ones and our friends. Take care.